Great. Hi, as she mentioned, my name is David Hawley, and I'm a recent heart transplant recipient September 1st, so not too long ago. Yes, I feel very fortunate to be here, especially with you guys. Congratulations on all the hard work that you've done in your college years, and I know University of Colorado is one of the best nursing programs in the country, so applaud to you guys for being here and making it as far as you can with school and leading into your future careers. So I want to talk a little bit about despair and hope. There's like a cycle of despair and hope for patients, especially patients with bad hearts or people who are leading into transplant. A little bit about myself. Love to go backpacking. You know, these are the things that I was doing before I had any heart issues. Like being in the outdoors, doing whatever I could out in the outdoors. I always had a resting heart rate of 65 to 75. Always had a low cholesterol level. Always had low blood pressure. And everything about me as far as physically appeared to be normal, and when I would go for primary checkup, no problems. They never worried about me until May 31st of 2013. Everything changed from that point. My wife and I were at the movies, and I went into ventricular tachycardia. As that was happening, I was gasping for air. Of course, I didn't know what was going on. My wife, could actually hear me. It was we were at Star Trek. There was this big action scene, lots of noise and sound going on, but she could hear me gasping for air next to her. So she nudged me and said, "Are you okay?" And I couldn't talk. I was gasping so much that I couldn't talk. I just shook my head. And it just so happened that a couple of months prior to that, we had gone to a emergency preparedness seminar, and they had paramedics there. And they said, if anybody's acting abnormal in any way, don't waste time, don't be afraid, call 911. And we're just waiting there for you to call us so we can come. And if we show up and there's nothing wrong, then great, no problems. If there is something wrong, then they're there. And so she yelled out for somebody to call 911, and people were like diving for their phones, and they came right away. She actually got a photo of me put in the ambulance. I was ready to watch the movie again. By the time they got there, the VT had gone away, and I was feeling fine, and the movie was just kept going. And as paramedics will do, they don't let on how bad things are. They just say, well, yeah, you seem fine, but let's just take you down to the hospital, get a few tests done, and so off I went. And it's a good thing that they did, because on the way I went back into VT in the ambulance, and my rate was up to 220 beats per minute. Pretty scary. You got a guy there that, to me, a relatively young kid, and my life's depending on whatever he's doing. But I didn't realize truly how bad things were until we got to the emergency room, and they cut my shirt off without asking for my permission. I really liked that shirt. It was one of my favorite shirts, and I thought, this is probably not too good. Something's really bad, and they're slapping the paddles on me, and all kinds of electrodes and so on. Eventually, I went into a VT storm where the VT comes and goes, it subsides, then it comes back, and I couldn't handle it. I reached a point where I couldn't handle it anymore, and my eyes rolled back in my head, and they hit me with paddles. And once I was stabilized, my wife thought this was the perfect opportunity to take a photo. Why, I don't know, but I'm really glad she did, because I can take you to the emergency room that I was in the night that this all happened. And as you can tell from the photo, it's pretty beat up. I'm pretty pale compared to what I am today. Anyway, so let's talk a little bit about hope. Right out of the gate, the doctors were very optimistic and positive with me and talked about options and things that they wanted to do, one of which was to implant an ICD, and they did that. And I felt really confident about the ICD. They would tell me things like, well, you're the safest guy in the room now because if something happens, it'll kick in and take care of you, keep you around longer. So I went back to my normal life there for a while. We lived in the San Francisco Bay Area. Like I said, I like to hike and go out in the woods. We had visitors would come, since we lived near San Francisco, and we'd take them on the town. I was feeling really well until July 22nd, which is not that long after, I mean about a month and a half after I'd been let out of the hospital. And this really was the scariest night of my life. At 11:25, my wife and I were getting tucked into bed, and I went into VT. She was already asleep. And the reason that I know that it was 11:25 is because I stared at that clock and tried to focus on it as I went into VT, and I really felt that I was dying. I felt like a separation of my mind from my body. My body was literally frozen. I couldn't move, I couldn't talk, and all I kept thinking to myself was, not now, not now. Yet there was nothing I could do about it, and I couldn't even wake my wife to get her help. And finally, just bam, I got hit by the defibrillator. My whole body jumped, and I was finally able to move. I woke my wife up, and I got hit by my defibrillator, and she said, "Are you sure?" Oh yeah, I'm sure. And so we called the doctor on call, told him what had happened, and he said, "Well, so you were just hit once, right?" And I said, "Yeah." And he said, "Well, go back to sleep, and if it happens again, then go ahead and call me." And keep in mind, it's 11:25 at night. He's looking at his clock too. And well, that's what the doctor said to do. So I went ahead and got back in bed. And about 5 minutes into it, I said, "There's no way I'm going back to sleep." So we called the doctor back and made him stay up overnight at the emergency room. And so anyway, he met us there. And I stayed in the hospital for a few days while they monitored me. And I was truly amazed with all the technology that was around me. I mean, if you go into just any of the rooms, at least in the cardiac area, it's loaded with technology that a lot of which has come out just in recent years. I was really impressed with this. They were doing an echo on me, and it's in color. I was able to watch my heart in color. I couldn't believe it. But the piece of technology that really struck me the most was the rinse-free shampoo. Now, I liked it so much that I got my picture taken in the same pose. After you've been in the hospital a few days, this means a lot to have somebody come and wash your hair. And I don't know, I felt like a new man. But for the rest of that year, it was pretty darn tough for me. A lot of despair. I was shocked by the defibrillator paddles twice. I was shocked 7 times by my ICD. I fainted at work and cracked my head on the cement. I was by myself too, by the way. I went to the ER 5 times. I spent about 4 weeks in ICU. I had 3 ablations, one of which was completely unsuccessful. They couldn't find the spot where the trouble was coming from within my heart. And then, of course, you've got the Keith Richards factor. Who doesn't know who Keith Richards is? There's a few, okay. The Rolling Stones. You've heard of the Rolling Stones? No?
Yeah.
All right, so he's the guitarist for the Rolling Stones. And Keith Richards was hooked on heroin for over a decade. He is he smokes constantly since he was a teenager. Yet he's in his mid-70s, having a grand old time on the stage, rocking and rolling with the Rolling Stones. This pissed me off. I'm 47 years old, struggling for my life, and this guy just keeps on going. And it really bothered me until I read this. For every cigarette you smoke, God takes away an hour of your life. He gives it to Keith Richards. He's going to be around for a long time. The number of smokers who are out there. But not just Keith Richards. Looking around me, I would see people who just aren't taking care of themselves, and they're doing fine, or at least they appear to be doing fine. Meanwhile, I'm going through hell. I mean, really, 2013 until November really was bad. And it's not just hard on me, but hard on my wife, of course. Finally, November, hope. Breakthrough. I'd gone into BT again. Doctors realized I was unstable and that they had an unsuccessful ablation earlier in the year. So they decided to send me to the University of California in San Francisco. And the head of the electrophysiology department took on my case. That's him there. His name's Dr. Gerstenfeld and Dr. Woods, and they found the spot. Dr. Gerstenfeld actually said that it was located on the band that holds, that goes across the right ventricle, and it was on the other side of it. It was like in a place where he'd never seen a bad circuit coming from. But anyway, he got it taken care of. And this is the moment when he got the spot. So I'm running about 210 beats per minute here. Where this line is when he finally was able to ablate the bad circuit, and I went back to a normal rhythm after that. I like to get out and hike and be in the outdoors. So it took a couple months for me to kind of recuperate, but eventually I started hiking. We hiked the Redwoods. We hiked the canyons of Death Valley, the High Sierra, the deserts of Arizona, and I even tried my hand at surfing. And if you look closely at the size of these enormous waves, you'll realize that I pretty much just kind of paddled in circles. But I had the equipment, so I can say I went surfing. So they bought me a year and a half. That was November of 2013. For a year and a half, I didn't have any problems, and I was very active and did all kinds of things. Then in April of 2015, we'll talk a little bit about despair. So I was on a hike, wisely by myself. But I did tell my wife where I was hiking and what time she should expect me home. And as I hiked on this trail, there's a lot of hills and stuff in Northern California area, and a lot of trails that are like this. And I started going into BT and could feel it coming on, and I quickly looked for a place to sit down. Wasn't finding, like a log or something. There wasn't anything to sit on, and I was really concerned that, hey, my defibrillator could go off, and I could go this way, and nobody would ever find me. I'd be down at the bottom of however long that hill is. And so, it dawned on me, well, if I face the downhill and I get shocked, I'll fall back onto the soft uphill. So no sooner did I face the downhill and I started to crouch down, I got hit by my defibrillator. It fell back. It was nice and safe and soft. I landed on the burns. And I immediately called my wife, and she came and met me on the trail and rushed me off to the hospital. All right, so after an ablation, things were looking pretty good for me in 2015. Went right back to doing things that I liked. We did a cruise up in Alaska, and found out my wife was pregnant with a girl. Things were going really well. Then, of course, 2016 came around, and we moved to Colorado. Now, that's not why you're in despair. But we got here. I don't know if you guys remember or who was here, but in April of 2016 was a giant snowstorm that was really wet, heavy snow. And I just felt this was like within 48 hours, we didn't even have furniture in our house. I felt this need to go and shovel the snow. And I know, I knew then and I know now, you know, people with heart problems shouldn't do things like that. But I think it was meant to be honest, because it got me back into the hospital. Just a few minutes into shoveling, I went into VT, got shocked immediately actually, fell to the ground, got shocked again. I crawled into the garage door was open at that time, and while laying there, I got shocked 6 times in a row. In between shocks, I was able to call 911 and yell out my address, so I could hear the ambulance actually coming. And that's despair. I mean, I know people who have PTSD just from being shocked a couple of times, 6 times in a row. That'll really mess with your mind. So I was whisked away to the hospital again, this time to the University of Colorado. More despair, once again, not because of the university. The stress test. I've always hated tests. Now you guys probably love tests, right? You've gotten this far. And I imagined I was going to do the stress test and I was going to look like this guy. I had the wrong impression of my own physique. And as I'm on the treadmill and they start going, wasn't but a couple minutes into it and I went into VT again. I mean, my heart was really unstable at this time. And they're ripping the stuff off my head and getting me back onto the bed. I stabilized and everything was fine. But that led to the hope part. They got me set up with cardiac rehab, and I loved it. I mean, I don't know, have you guys, I don't know if you've seen the facility that we have here, but you can see all the equipment that they have. And I liked being able to exercise because I always like to be active, and to know that I'm being monitored and taken care of while I'm doing that, and somebody's keeping an eye on my heart. I really enjoyed that. They got me set up for evaluation to see if I would be a good candidate for a transplant. I don't know if you guys know much about that, but it's a 3-day evaluation. They do all kinds of tests, including right heart catheterization. This is what I learned, that you have to be careful which nurses you give your camera to take photos. You'll end up with a selfie. They also had me do a blood draw. When I say blood draw, I mean blood draw. And they did, if that weren't enough, they did another one a couple days later. It was about the same number of vials. And, you know, pulmonary tests. They had me meet with social workers, finance people, dietitians, just a myriad of people to determine whether I was a good candidate for a transplant. Then on August 5th, 2016, I was accepted to the transplant list. I got a phone call and I was very excited about that. As 2016 rolled along, I really felt, but the call could come anytime. Of course, I'm on the list now. They could come anytime. And so I had my phone on 24/7. I was woken up by more telemarketers at night than you can count. But I thought it was worth it because I might get that call. But as 2016 wound down and we went into 2017, I really started going into despair because I didn't know what was going to happen with my heart. And there was just a lot of anxiety going on in my mind at that time. Let's go through some of those. I was afraid, of course, of being shocked again after what had happened in April of the previous year. I was afraid of having such an invasive procedure done on me, of course. Scared I wouldn't live long enough to actually get a transplant. What they're going to do to me during the procedure. I mean, they're going to be cutting my sternum, pulling ribs apart, removing my heart. I mean, all this stuff really scared me, of course. Something going wrong during that process. Rejection of the new heart. So even after the transplant, they're concerned with rejection, which I did have a little bit while I was still in the hospital, so they were able to respond to that quickly, and I haven't had any problems since. And then fear of infection or disease, because I would have a lower immune system since I had a new heart. These things, for every half hour that I was awake, one of these things would be crossing my mind. It was on my mind pretty much constantly. Very scary. Then I got a CT scan of my heart, and what I saw really, really disturbed me. I mean, to me, this doesn't look like a heart. It's misshapen, it's covered with scar tissue. I just really felt, the end was coming near, and I was sleeping. I would take a nap in the morning for 2 hours and a nap in the afternoon for 2 hours. But at the end of the day, I still couldn't stay awake. I had to, for my daughter's first birthday, I had to leave early. I couldn't stay for a whole birthday party. And hope, transplant. We got the phone call on the 31st of August, and they did the procedure on the 1st of September at 3:30 in the morning till 9:30 that morning. So my wife and I quickly packed up our stuff, and this photo was taken as we were entering the hospital. And it was really a strange thought to be standing out there, that knowing that when I leave, I'm going to have a different heart in my body. It's a really unique experience. But I went through it, and they had me walking literally the first full day that I was there. Lots of equipment, but by the time I left, I was here for 27 days. I was already doing stairs and going around without all that equipment. Now, I wish I had a photo with all the nurses that took care of me during that time, but these are the ones that were on staff that night, and the care that I received was really beyond belief. I've spent a lot of time in a lot of different hospitals, and you guys here really are the best. Okay, so I've talked to you all about hope and despair and this back and forth that goes on, and I think you're going to find from your patients that they've all been through something similar to what I've been through. And I think you're going to find three types of patients. Ones that are grumpy and mean and are rude. Ones that are non-compliant and just sit in their bed and don't really do anything. And actually, I'm going to need, there's going to be one more slide where I'll need to move that. I don't know. Oh, I can move it myself.
Yeah, it should move. Yeah. One of these two
Well,
Okay. Okay.
Anyway, and then the third patient would be somebody kind of like me, who's proactive and is trying to get themselves as healthy as they can, as quickly as they can. The important thing for you guys is to treat all three types of patients exactly the same. Even though someone's rude and doesn't treat you well, when you go into their room, you still have to go back in that room with a smile on your face and willing to help them. And I think getting to know them, if they'll let you, even if they're rude and not very friendly people, you might eventually crack that shell and have a breakthrough. And now the arrow's gone. Let me move it. And if you're lucky, they'll get a transplant, and you'll get to read Bob's bell.
Bob's bell. As I embark on my transplant journey, I stop to recognize the following. I ring this bell once to honor my donor, twice to celebrate my strength, and 3 times to encourage those who follow in my footsteps.
I thought the bell would move back and forth if I pulled down. So anyway, that's what you do when you're leading the cardiac area of transplant. And anyway, I just can't say enough about this hospital and the things that they've done for me. I've been healing up very well and back in cardiac rehab, enjoying that very much and staying as active as I can. I went and bought a treadmill, so even the days that I'm not at cardiac rehab, I'm still walking and eventually running. So that's it. That was my presentation. So.
Anybody have any questions for David that they want to ask him, or?
Yeah.
Did they remove your defibrillator when they did the transplant, or is that still in you?
No, I have it. If you want to see it, I've got it in my bag. There's a funny story though with that. So I was looking at it one day and I could see the little cables coming out of it, where they'd been clipped. And I asked the nurse, I said, well, are those cables just still floating around in my heart? And she just smiled and she said, you don't have that heart anymore. Oh yeah. So she said, that one was the other one. So did that answer your question?
Yeah.